Hi, I'm here to talk to moms, dads, brothers, sisters, and partners of those with epilepsy. I also love someone with epilepsy, and as a nurse, I always thought I was well prepared to help anyone who was struggling with a disease, until I got a call that my partner was in the hospital. He had his first seizure, and I suddenly wasn't as calm as I usually was with illness. Since that day, when we started this journey with epilepsy, I often thought, will he be okay? Am I okay? Do other people worry this much when someone they love has a seizure? Today, I'm going to share some basic seizure first aid and what life may be like for families after that seizure. I hope that you'll find some guidance and know that you're not alone. First, let's review some safety tips. Seizures can happen at any time or anywhere, so it's important to be prepared and know what to do. If your sibling, partner, or child begins having a seizure, do your best to stay calm. It can be really scary to watch, and it may look like they're in pain, but they're not. The brain tells the body what to do by sending electrical signals, but sometimes these currents become uncontrolled. This electrical storm is what is happening during a seizure. Typically, it only lasts a minute or two, but that can seem like a long time, especially if you're watching someone you love. During the time they're having a seizure, try to remember some things. Move objects away from them, don't put anything in their mouth, and be sure not to hold them down. It's also a good idea to turn them on their side, and you may put something small and soft under their head as a cushion too. To keep your family members safe, know when you need more help from medical professionals like nurses and doctors. Call 911 if it's their first seizure, it lasts more than 5 minutes, you notice they're not breathing normally, there are multiple seizures in a row, the seizure happens in water, or if the person is sick, injured, or pregnant. After the person who has had a seizure is safe and their normal selves again, it's important to consider your emotions and needs as well. It's normal to think about the seizure often, feel sad, anxious, or fearful, especially if you and your family members haven't been through many before. Watching and caring for someone who has had a seizure can feel traumatic, and after any big type of event, be kind to yourself and do activities you typically enjoy. Try to continue with your normal routine, eat regular, healthy meals, move your body, and go to bed at your usual time. And lastly, when you feel comfortable, talk about what happened with caring friends and family. It can be helpful to know that everyone handles these events differently. This can be especially true if your relationship to the person having a seizure is your partner, child, or sibling. Because of these differences, we're going to explore these feelings separately and what may help in moving forward. Based on many interviews and current research, each person will echo commonly seen trends among the groups they ascribe to.
Sometimes I feel scared during my sister's seizures. When that first started, I was extra afraid because of that I didn't know what was going on. I know seizures are something that's not normal coming from the brain, but it's good they don't hurt. I feel better now that my mom and dad taught me what to do if I'm there when they happen. To be honest, some days I feel a little lonely because of all of this. Sometimes my mom and dad can't spend time with me because they have to be with her. But I know it's because they have things to do to keep her safe and healthy. I always remember that I'm supposed to talk to an adult about my bad feelings, though, especially if I get nightmares or my bad feelings take my mind away from school or friends. Things can be hard, and I know that things are a little different for my family, but I wouldn't change my sister for anything. I love her.
I would do anything to take epilepsy and the seizures away from him. I promised myself that I would protect him and keep him safe. Since the day he was born, that has been my goal. I felt helpless at the beginning and sometimes still do. Thankfully, there are a few things that have really helped me on the difficult days. I find comfort in talking to other moms and dads who have a child with epilepsy, like the scary feeling of watching your child sleep next to you in bed, hoping their breathing stays regular after the seizure they just had. I also feel better knowing I'm prepared. I try to do everything the doctors tell me. I also learn the importance of giving him a normal life, letting him play the same games and go on the same field trips as the other kids. I have to remind myself that I can't always control his environment. I guess overall, I worry about his future. I just want the best for him, but I know keeping myself physically and mentally healthy is what's best for all of us. I would say the silver lining is how strong our family is today. We are closer now more than ever.
My wife was diagnosed with epilepsy a couple months ago, and it's been a lot to adjust to. Since that day, when she had her first seizure, went to the hospital, and got that very unexpected diagnosis, I really haven't been sleeping well. I've been having a lot of anxiety and feelings of depression. For a bit, I was feeling even worse because I would get frustrated at her easily, even feeling a little resentful. When she doesn't answer her phone or get back to me, my mind sometimes goes to the worst. I worry about her long term health, our financial future, and the strain on our relationship. However, things recently began to turn around when I started sharing my feelings with her and got more involved in her doctor's appointments. Her doctor is wonderful, and it no longer feels like such a lonely pursuit. When I felt ready, it also helped to talk to my close friends and family. Truthfully, it's been a slow process, but with time, I've been feeling better.
As you may have experienced yourself, the challenges of epilepsy go beyond just the individual diagnosed. Take some comfort in knowing that with time, these worries, fears, and sadness get better. Know that you're not alone. Reach out to a support group or talk to a trained counselor if you find that these difficult emotions are frequently butting into your daily thoughts, relationships, or activities. I want to leave you with one final thought as we walk this road together. One older sister of someone with epilepsy reflects.
This is what a strong family is all about, being there for one another and getting through what life throws at you together.